Hello, everyone. Welcome to our event today. My name is Hilaria, and I'm an
I have this disease, so I'm trying to help someone else to get better.
I had COVID-19, I've since recovered. The NHS asked me if I was willing to donate plasma, and here I am.
To be honest, considering that you could be potentially saving somebody's life, it's really not a problem.
I filled out the form online, got a phone call, answered a few questions.
I had my health screening, declared that I was fit, sat me on a chair, told me everything that's going to happen really clearly. Here I am.
10-15 minutes since I came in through the door until I was fully set up, and now I'm donating some of my plasma.
Nobody's allowed in until they've been triaged. They are asked a specific set of questions just to make sure that them and their family, anyone they've been in contact with as well. It's such a simple procedure. This could save someone's life.
It's easy, so if anyone can do it, I think they should.
Everyone had masks and hand sanitizer. Everything that your blood touches will be changed.
I feel safe, I feel well taken care of.
The staff here, they've been really welcoming.
Really friendly, all of them. Always concerned about my well-being.
It's been an enjoyable experience.
It doesn't hurt, it takes maybe an hour of your time, and it's good to do.
Save lives, do something amazing.
So thank you very much for watching that. So as you all know, things have been really bad for us during this period, the coronavirus, and it has actually affected a lot of people in the community. So we are trying as much as possible to see what we can do to educate people in the community about coronavirus. So that brings me nicely to what we are about to talk about here today. As you all know, as I said before, we've been seriously affected by coronavirus. We've lost a few people in the community and some have survived. However, this virus is still here, and we know that there are new variants coming in all the time. This is all new to us, but despite that, we have people who have been affected by COVID. But as a community or an individual, you can donate to help these people have a chance of surviving this virus. So today, we have some medical professionals involved in this process who have come to speak to you, our community, and answer any questions you might have. You all know Theo, a consultant orthopedic surgeon with Pennine NHS Trust, from the last event Youth Speak Out, and he'll be moderating today. If you have any questions and would like to come on stage, please let me know and I will invite you into the studio. But first, I would like to introduce you to Amanda Dockeray. She works on the team of blood plasma donation recruitment. She will tell you more about herself and what she does. Welcome, Amanda, and thank you for coming in today.
Thank you very much, Hilaria. Thank you for inviting me. I really appreciate this opportunity. And I'd just like to say good afternoon to everybody and thank you for joining us today. My role in this is as a convalescent plasma donor recruiter for the Greater Manchester area. And I'm part of a larger team that covers the whole of the country. My base is from Plymouth Grove, which is the donor centre in the centre of Manchester. There are two in the centre of Manchester, one at Plymouth Grove and one at Norfolk House, and Norfolk House is in the very city centre. So in terms of what we're looking at today, I'm here to assure anybody, having visited the donor centre myself and been involved, that anybody who does volunteer to donate their plasma will be extremely well looked after, extremely well cared for, because everybody really appreciates anyone who is prepared to come forward to help in this cause, to help fight this awful pandemic. So I'm hoping, and I'll just ask quickly if Professor David Roberts is available, please. Could I introduce, please, Professor David Roberts, Associate Medical Director of the NHS Blood and Transplant and Medical Lead for the Convalescent Plasma Programme, who will talk a little bit more in detail about what we're looking at doing. Thank you.
Hi, thank you very much. Can you hear me okay?
Yes, we can hear you, Prof. I've got your image up, but nothing else, but we can hear you nice and clear.
Great. That's fine. My name's Dave Roberts. I'm the Associate Medical Director for NHS Blood and Transplant. That's the blood service in the United Kingdom. We operate actually in England, and we provide blood and platelets and some medical services, but the fluid part, it contains lots of proteins, but it also contains the antibodies that circulate around the body. And the reason it's of interest to us is that those antibodies made against the coronavirus may be effective in helping people who are sick with pneumonia or severe disease. So I'm going to tell you, I'm going to try and share my screen now and just show you a few slides. So let's see if that goes on. Okay, can you see my screen now?
Yes, coming across quite nicely, Prof.
Okay, thanks very much. Okay. So let me just show you a little bit about what we've been doing. Just a little bit about convalescent plasma to start with. It's actually been used for over 100 years. And before people had antibiotics, they actually used plasma to try and treat disease, particularly epidemic disease. And people first used it to treat diphtheria. And a chap called Emil von Behring used it over 100 years ago and actually got the Nobel Prize for that work. So it's had a very long history. But people have thought it is effective against respiratory viruses, and people have used it for the flu viruses. They used it in the 1919 pandemic. They've used it for the different flu pandemics, and also for the previous SARS epidemic. But in order to use it, we first of all have to collect it. And what we've found out that there are some people who have more antibodies than others, and it turns out that certainly the more ill you've been, the more antibodies you may have. Also, men have more antibodies than women, and it's certainly true that people from Black and ethnic minorities also have high levels of antibodies. So we've set up a collection system, but what we need are people to help us who've had COVID. And so we're asking them to donate plasma. At the moment, we're collecting it and using it in trials, in clinical trials of people who are sick with COVID. So it's useful to have what we'd really like if people can come forward, particularly men. Our age limits for donation between 18 and 65. People in hospital have the highest level of antibodies, and both Black and Asian donors we found do have very good levels of antibodies. So at the moment we're collecting from people who have been recently infected, you have to wait a month after symptoms disappear. So if people have been infected in December and January, they can certainly come forward. So at the moment we're working on with a variety of institutions throughout the health service and through a lot of social media groups to get our message out. So I've already told you a little bit about convalescent plasma, but we use that word a lot, but it's perhaps just worth explaining to you a little bit more about it. This gentleman has given some plasma, and here he's holding up a bag of the plasma that's been collected. You can see it's this straw-coloured, yellowish fluid, and it is this sticky fluid bit of blood in which the red cells float. But after a virus infection, your plasma will have really quite variable levels of antibodies. Some people have very high levels, and it's particularly that plasma that we will use in trials. The antibodies, we believe, can help stop COVID. We don't think now the first trials have shown that it is probably not effective when people get very ill, but is likely to be more effective in the early stage of illness. So at the moment we've finished a couple of trials, but we're planning a trial to look in particular at people who are sick with early disease. So in terms of what we need and what you can do when you actually give plasma, you can volunteer to give plasma for up to 4 months after you've had COVID. There are a number of requirements for donation, but we will, if you register your interest, we will check with you if you're medically fit to donate. There are in some cases, we are testing people when they come to the centre. In other cases, people come straight to give donation. So what we're doing is to ask people to come into a donation centre where we have special equipment for taking the plasma. This is a plasmapheresis machine which takes your plasma, and it's a continuous process. You have you can see this chap's got a needle in his arm. Blood's taken out and it's spun round. The plasma is collected and the blood cells are returned back. The process takes about 45 minutes, and the body can usually replace the plasma in just 1 or 2 days. So people can return to work. They can drive, do absolutely normal things after they have given plasma. We've allowed people to donate as often as once a week. So I think if we just remember these facts, these are the key things about donation. We still need donations. It's particularly people who've been in hospital or had a severe illness at home. Men who've had hospital care are 6 times more likely to have high levels of antibodies, and those antibodies also stay level for longer. As I've mentioned, BAME BAME people and men have who've been more badly affected do tend to have high levels of antibodies, and we think that's because the more ill you are, the more the immune system reacts, and the more antibody production is stimulated. We've had about 300,000 people coming forward, and we've taken about 60,000 donations so far, but we're still continuing to collect. So that's really those are really the main facts about donation, the main facts about convalescent plasma. But I'd be very happy to answer questions. I'll just stop sharing the screen now.
Thank you very much for that overview into the convalescent plasma program. I'll just kick off with one question, if I may. There was, I think, an interruption to the convalescent plasma donation program sometime around I'm not sure if it was around the beginning of the year, and then restarted. Maybe not the program, but the use in the treatment of patients with COVID-19. Can you throw a bit of light on that?
Yes, so we've done two very large trials. When the plasma collection program started, it was clear from the Department of Health and from Professor Chris Whitty that the plasma should be used in trials. Although plasma's been used before, I think people, on like any new medicine, people don't know exactly when to give that medicine. So we started two large trials with the sickest people. We did one trial in people who were in intensive care and another trial in people who came into hospital, most of whom required oxygen. So those trials recruited a lot of people, 14,000 people altogether. And in January, they stopped those trials because they felt they had enough information. And at the time, because we are instructed by the Department of Health to collect plasma, they felt if the trials were no longer recruiting people, we should stop collecting. So we paused collection for a week, but then it's become clear that although those trials don't show an overall effect of plasma, other evidence has come forward from other small trials and from which I can tell you about in a minute, but also from studies of many thousands of people in America, that it's become clear that it's likely that plasma's probably only effective in people before they become severely ill. So at the moment, we've submitted an application for this trial and it's just being reviewed. We're working with the funders and the Department of Health to establish if we can do the trial and how we should do that. It's a little bit more difficult because we think we're going to, in the future, recruit people who are not in hospital, but who test positive, but within the first 3 days of those tests, we would need to treat them. So at the moment, then, we are collecting plasma to use in a third trial. And that's the reason we will continue to collect plasma. Okay, does that help?
Yes, that's very helpful. So one issue about plasma donation or convalescent plasma as it affects people from the Black community. If people travel, for instance, to sub-Saharan Africa and they come back to the UK, are there any, maybe on a holiday, maybe to visit family, are there any restrictions on when you can donate?
Well, there are, but at the moment, no. I mean, I don't think so many people will travel. There are some restrictions. If you go to a malaria zone, there has to be a time, period between you going and coming back. So at the moment, obviously these travel restrictions and requirements are probably only going to affect. Perhaps I think they're unlikely to affect people who've got coronavirus. And as you know, at the moment, international travel has stopped. So I think when normal travel resumes, yes, there may be some restrictions on people who travel.
Okay. And with regards to collecting plasma for the purpose of the benefit from the antibodies, is there any work, let's say, on people who've had vaccinations who may have antibodies? Is that of any use? People who haven't had COVID-19 but perhaps have been vaccinated?
Well, that's a really interesting question, actually. So I'm sure you know that there's several new variants circulating. It does seem that the vaccination gives protection against not just to the original variant, which we call the Wuhan variant, but also to the newer variants. Now, at the moment, we're only collecting plasma from people who've become infected, but there are reports that people who have been infected and are then vaccinated can have very high levels of antibody, and those antibodies do actually cross-react, probably better than the antibodies if you just have the natural infection on their own. So we're actually setting up a small study to look at people who had the infection, gave plasma, but have now had a vaccination. So in future, I think the answer to your question is, at the moment, we can only collect plasma from people who've had an infection, but we are looking to see if having an infection and then being vaccinated produces an extra effect. Does that make sense?
Yes, it does. So just to mention that in addition to indicating by raised hand that you want to ask a question, you can also use the chat function. But I'll also go through to just one more aspect as it affects the Black community. In terms of blood and solid organ transplants, there's the issue of compatibility, where perhaps you're more likely to get a match if you have a donor from your own ethnic background. Do the same issues apply to plasma? Can plasma from anybody be safely given to anyone else?
Well, those are very good questions. The requirement for matching plasma is very simple. It really only needs I'm sure you've heard of the ABO blood groups, Group O, Group A and Group B. So we only have to match within those groups. So it's very simple matching. But you've touched on a very important question, which perhaps if I may expand on. We have a very large requirement for blood for people from an African and sometimes a Asian background who have sickle cell disease or from thalassemia. And indeed, blood therapy is used not just to top up people if they're anemic, but sometimes to do much bigger transfusions, such as exchanging blood. So I'm sure you'll have heard of this, and many people on the call will have heard of this. And so there's a very large requirement for blood for sickle cell disease, and there it's extremely useful to have blood from people who have African heritage, and they may, of course, be from Africa. They may be in the UK for a long time, or they may be from other parts of the world. But that is extremely useful, and in sickle cell disease, blood doesn't just improve the quality of the life in the short term. It can be used to prevent strokes and so on, or very severe chest disease. So blood is extremely important in treating sickle cell disease. And if anyone on this call, and perhaps through the groups they're in contact with, can help us recruit people to donate blood, that would be extremely useful. And the second thing that you've mentioned is also very important. When we have to match either cells to give what we call a bone marrow transplant, but it's actually the stem cells or the cells that can make blood cells that are transplanted, there's a very specific tissue requirement, and there are many thousands of different tissue types. And each ethnic group does tend to have its, their own tissue type. So there, it's extremely useful to have people from different ethnic backgrounds, and we really need lots of people to register. It's in those cases, it's not. Each person has a very small chance of actually being asked to give cells for a bone marrow transplant or a a stem cell transplant. But it's very, very useful to have people typed and registered, because what we do if someone needs a transplant is look through all the registers. In fact, we look into from right across the world, and if we find a match, we can get those stem cells and transplant. And again, those transplants can be life-saving. So apart from, we're talking about convalescent plasma today, but I think the whole question of having blood products and stem cell products to match our, to match patients is really important. And it's something that, each community can help with. I mean, obviously, there are lots of people from many different ethnic backgrounds, but we particularly do need more people from the very different, black and ethnic minorities. And I've worked a lot in Africa, actually, and I know how diverse populations are there. So the more people we get them, the better. And I think it's something that I hope many people on the call will be interested in registering for an interest either in blood donation or stem cell transplantation, and not just to do it themselves, but perhaps to interest people in their communities and the social groups and community groups, churches that they work in, and so on. Okay, I hope you don't mind me digressing a bit, but it's an incredibly important point, actually.
No. I think it's very it's very useful information, actually. Now there might be people who are already blood donors, may wish to donate plasma. Is it one or the other? Can you donate blood and plasma? And can you choose which you donate?
Oh, hi. I've managed to turn on the camera now, so you can actually see me. So at the moment, if you're ill, have been ill with COVID, we really only want to collect plasma from you. The trouble is that if you collect blood, we have to leave a gap before we can collect plasma or blood again of up to 6. If we collect blood, we have to wait for 6 weeks before we can collect plasma. And that's because it takes time to make more red cells and takes quite a lot of iron. So we're limited in the amount of blood we can take, but plasma we can take a lot of. So I think if people have been sick with COVID, I think the first thing is to concentrate on plasma. And it may be that, lots of people who come forward, unfortunately, the antibodies levels aren't high enough, because we do need people with very high levels of antibody, because obviously when we give a little bit of plasma, it gets very much diluted. We don't give pints or litres and litres of plasma. We just give quite a small amount. So we just need people with the highest level of antibodies. But when the plasma donations are finished, then people can give blood. So I think the possibilities are, if you've been sick and you've got high levels of antibody, please give plasma. If you have low levels of antibodies or you haven't had COVID, please register to give blood. Okay?
Okay. Now, a friend of mine who donates plasma, he had mild COVID, but his antibody levels, he's told, are high. And he kind of has a chat with me every now and then and says, quite reassuringly, I went to the plasma donation last time and my antibodies are still high and they still took some plasma off me. Is that like a good marker as to how your, level of immunity is going? Does that give some reassurance to people as they donate plasma that they still have a certain amount of immunity?
Well, I think yes, I think it does. We stop taking plasma when the antibody levels are still quite high, but also what's important is that if someone who's giving plasma was unfortunate, for example, to come across the virus again, in other words, they were infected again, the body would very, very quickly switch on new antibody production, because we don't the antibodies are made by special cells in the body, and in fighting the virus, we use lots of different types of cells, and those are still there, and they're primed to act. So normally when people have been infected, those cells spring into action if they ever get infected again, and it's very, very unlikely they would become seriously ill again. I mean, as with many other infections, once you've had an infection, your body has enough immunity to fight it off, and most of that immunity, almost all of it, is centered in the cells, and we leave those alone. So if you have high level of antibodies, that's great. It means the antibodies can protect you, but also it means you've got lots of cells there that will be very protective if you see the virus again. Is that okay?
There's a question that's come through which asks whether clinically extremely vulnerable people are able to donate plasma. And I probably want to look at this in two ways. The clinically extremely vulnerable, that would be the people who've been shielding. If they've had COVID, can they donate plasma? If they haven't had COVID, considering that they're still being advised to shield until the end of March, how safe is it for them to donate plasma?
Well, you've got to have had COVID to donate plasma. So I think if people who have had COVID, they could come forward and donate. If people are extremely vulnerable but have had COVID, I imagine their risk of having COVID again is less. But I think the problem there is that if they're very vulnerable, they may have other diseases which may make it difficult for them to donate. So I think if you're extremely vulnerable through other illnesses, I think it's unlikely you'll be able to donate plasma, because you probably can't. It's really because there are other medical conditions that you may have, and we can't take donations in those cases. Does that make sense?
Yes, it does. And I may add that if they go on the NHS BT website, there are probably some click-through charts which might well tell them that they're disqualified.
Yes.
Or unsuitable for donation before they get too far along the process.
Yes. So I can see another question in the chat that a man has said that he had a mild form of COVID, was at home and self-isolated. Can I donate? Well, I think the best thing is to register on the website. At the moment, we do have a lot of people who've been in hospital, and we are concentrating on people who have been tested. But I think the best thing is register on the website, because what we will do is use that information to ask people to come forward if we don't have enough people who've been tested. And also it's registering interest in the blood service, and we can use that list to approach you to perhaps give blood in the future. I mean, if time goes by, if you register, time goes by and we don't approach you, perhaps you could register to give blood, in perhaps 4 or 6 months down the line. Does that help?
Yes, just a follow-on question on that. If somebody has mild COVID, maybe just self-isolated, and they don't have antibodies, can they donate conventional plasma outside the convalescent plasma scheme? Is that still running? Because these are people who say, well, I'm happy to have a needle stuck in me to have some plasma taken. I may not have good antibodies, but if you can use my plasma, is that scheme available?
At the moment, we're not collecting plasma just for routine use, but we may do in the future. You may have heard this week that the government has lifted. Previously, we didn't use plasma from the UK population, but the government has now decided we can do, and so at the moment we're just using plasma from. Actually, when people give blood, we sometimes can take a little bit of that plasma from the unit of blood that people give, and we're using that at the moment. But in the months to come, we might well start large-scale plasma collections. That's all to be decided. So we haven't got firm plans of where and how we're going to do that. We have to get agreement from the government and various other arrangements, but it is possible in the future people can give plasma. Yeah. So
what I would say to those who have mild COVID is certainly inquire about the process. Even if you don't have sufficient antibodies, maybe think about being a blood donor, because that's always required. And perhaps in the future, you may be able to donate just plasma.
Yeah.
But there's another question coming about people with sickle cell trait. Generally, we refer to these people colloquially as the AS people, not the people who have the full sickle cell disease, but just the trait. And I think most people will know what the AS people are. Can they donate?
Yes, they can donate. That's fine. We're not using the red cells, so the plasma's fine.
Okay.
That's
if they have sickle cell trait, are they excluded from red cell donation, blood donation?
no, they're not. But we would probably not use their blood for treatment of patients with sickle cell disease, but we could use it for other patients. The problem is often in the sickle cell patients, we're trying to reduce the level of sickle cell hemoglobin, but we could use it for lots of other people. And there are lots of other people from sometimes people from Black African heritage may have particular blood group types that are very useful. And of course, people get sick with all sorts of diseases from all sorts of backgrounds. So we would use their blood for other people who are sick. So that's absolutely fine. Okay.
Okay. Just something on the practicality of the plasma donation process and the blood donation process. I don't know if yourself or Amanda will take this. I remember from a previous experience a while ago of giving blood, the needle is quite large bore. Is it still as big? And is it the same bore needle for plasma and blood, or are they? Because some people describe it as a painless procedure.
Okay. It is quite a big needle. I think people, people are used to, quite small needles for injections, and that's because you're only giving a small volume of fluid. It is a bigger needle. I mean, it's not a huge needle. It's about, the inside of a, biro refill. So it obviously, it's not a very thin, like a sewing needle, but it has a very fine tip, which I know as a surgeon you'll know about, that it has a very fine foot. I mean, I think people are frightened of needles, and I do understand that. But as we live in our everyday lives, we often get mild discomforts when we just bump into something or touch our. There are all sorts of ways in which we can get very mild discomfort. It is not a severe pain, and it's not prolonged, and many people don't even feel it going in. So I think the thought of it is much worse than what is actually happening. I would encourage people to become donors. I mean, there's a million people actually giving blood at the moment, and many more than that who've given blood in the past. So lots of people do it. I'd be wrong to say you can't feel it, but I give blood. I mean, it's not a severe pain. It's not something I worry about. It's not anything that lasts a long time at all. I don't want to give the impression that there's absolutely no feeling at all, but I think it's also true. It's not severe, it's not prolonged. And I think the thought of it, like all these things, is much worse than anything, than the reality. I mean, a lot of people don't feel it at all. Does that make sense, Theophilus?
It does. It does. The charity, the WSHBME, does support a lot of people who have end-stage kidney disease, have dialysis, or have had transplant, which is probably why the next question asks whether it is like dialysis. Is it like the dialysis process in terms of retrieving plasma? So do you have something going out and coming back in?
Yes, it's a bit like it. I mean, the actual machine is very different, and what we're trying, I mean, obviously, for people don't know, in dialysis is for people with kidney disease, and you have to filter the plasma and take away the things that should normally be taken out by the kidney. But then you put the rest of the plasma in. In this case, we're taking the whole blood out. We're taking off all the plasma, and we put back a bit of just all, fluid that we use. It's just all, it's not water, but it looks like water. It's got a little tiny bit of salt in it. And we mix that with the red cells and give that back. But it's the same way that we take, we have to take blood out and put something back. But it's quite a short procedure. It's about 45 minutes. It's not a long procedure. Dialysis, I think, takes quite a lot longer than that.
Yes, it does. And hopefully that should be reassuring for one to donate plasma and/or blood. You talked about the body replacing the plasma over 24 to 48 hours. Can you go back to exercise in that period where you might sweat and lose more fluid? Is there a period where you need to be less active? Can you run after the day of plasma donation or the day after?
Yeah, I mean, I think you've got to be sensible. You make up the fluid very, very quickly. We encourage people to drink fluid before they either give blood or plasma. It turns out that if you drink a pint of, I still use pints, but half a litre of fluid before you give blood or plasma, it actually has a very beneficial effect, because the fluid in the stomach actually helps you compensate for losing fluid even before it's absorbed. It stimulates the body, and some people do feel a bit dizzy. Some people, 1 in 1,000 people do faint, but it actually reduces that even further. So I think we've taken fluid off and we put fluid back, and the body would take, I would think, a day to get the fluid levels completely right. I think you can exercise after giving plasma, but I think you have to be sensible. I wouldn't go off and run a marathon, but people could do light exercise. I think it would be wise to wait till the next day before doing strenuous exercise. I think we have to be realistic. I think on the day of donation, do take things easily, but you can drive, you can you can get back. You could probably do some light exercise. I wouldn't do something too strenuous though.
Okay, thank you very much. You did mention before that you can go back to work on the same day and just take things easy, which I think is quite sensible. 2 questions. I think you covered this in your talk. The first question: the success rate of COVID patients with plasma treated with convalescent plasma.
Well, let me tell you a bit about that. It looks like if you're very severely ill, it probably, what we found out is that it doesn't have any beneficial effect. And, people have given a lot of plasma. In America, they've given about 100,000 units, but they never stopped to find out who's benefiting from it. And the trial we've showed is that really it doesn't look like it benefits people when they get not just in the intensive care patients, but probably doesn't benefit people once they require oxygen. But the study that we've been looking at was a study from Argentina in South America, and they looked at people before they went into hospital. And they looked at people who are very vulnerable. So they looked at people over 75 or who had other conditions. And in people who didn't get plasma, about 30% of them had to go into hospital for treatment. And in people who did get plasma, about 15% went into hospital for treatment. And in fact, if you got a very high level of antibodies, only 7% went into hospital for treatment. So that trial, which is very small, is probably the best evidence that we've got that plasma given early within a few days of the test in very vulnerable people, so people over 75 or over 60 with a medical, with a serious condition, other medical condition, could benefit very substantially. And I think it's an important point. People ask, well, why did you do a trial, or shouldn't you just have given the plasma? I think almost the fact the trials were showed that if you're severely, it didn't work, allows us to focus on people who can benefit. And I think it's an important point that people only do trials in medicine when we really don't know if there is an effect. And even if there isn't an effect, it's incredibly useful, because it means that we can work out then who will benefit. So we have to trust in the process that the trials are a way of targeting the right treatment to the right people. And they have shown us that really it's the people who just got the infection who may benefit the most. So that's what we would plan to do, a trial on a bigger scale and probably involve a wider group of people, some people like the over 70s. We think that even after vaccination, there will be people who are still vulnerable, and some people who don't get the vaccine or don't have a very strong effect, who may still become ill. So the trials have really helped focus the idea of who could be treated. And the other important point of the trial is that it gives us some idea of the dose required. So we think we've got to get a very high dose in, and that's going to help us select the right people to give plasma for patients. So I hope that helps.
Yes, just in terms of how the convalescent plasma is given. So I can imagine how it's given to people in hospital who perhaps are quite unwell. People outside hospital, do they have to attend hospital to have it given? Can it be given in an outpatient setting in hospital? Do you need to be admitted to have it?
Okay. So at the moment we haven't actually started this trial, but what we plan to do is to get people to come in for an hour or so to just get a unit of transfusion of plasma, and then go home. So that's what people would mean by an outpatient. We don't think we could give this in a GP surgery. So we would be able to use the clinics in hospital where people do come in for treatment. And then many of those, you can do it in the emergency department or in a kidney unit or in a hematology unit. And now people have set up, made sure that in those outpatient areas in hospital, there are areas where you can treat people with COVID. So we plan to do it as an outpatient treatment, if that makes sense. Yeah. I think it's important. I think whatever therapy we use for people who are coming, who have just had COVID, I think it's likely to be an injection treatment with antibodies, and I think it's likely that it's more useful to give it into the vein. In other words, to get it straight into the bloodstream, because then you can get a high level very quickly. Because from the results I told you about, it, even giving antibody therapy early doesn't stop everybody going into hospital. And I think I think if you give it, for instance, we can give injections into the muscle, but it takes about a day for the antibodies to get in the bloodstream. I think, you know, if we are going to use antibody therapy, we need to give it early and quickly. So we will use outpatient treatment. Is that okay?
Yeah, that's fine. I'll read out a question which says, if people from the Black community donate, where or who does the plasma go to? Is it like blood where it goes only to the Black people from the community? So I'd like you to comment as to whether blood donated from Black people actually goes to Black people community, or is it more likely to go to Black people?
Yeah.
And also where the plasma goes.
Okay, I think those are very good questions. Well, when we take blood or plasma, we don't label it with people's background, but we do label it with people's blood type, and obviously we also give it to the people who are sick. So if we take blood first, if you've got if you're from an African background, or then some of the blood groups that you have are more likely to be a match to other people from African backgrounds. It's not the I'm sure everyone knows whether they're Group A, Group B, or Group O, but there are actually hundreds of different blood groups, but there are about 10 blood groups that are actually important in transfusion. And the pattern of those groups is, if you're from an African background, is more likely to match someone from an African background. So the other reason why we're more likely to give blood to someone from an African background is that that obviously all the sickle cell patients who use about 10% of our blood are mainly from an African background. Some are actually from Asia, but most people are from Africa, of course. So if you are from if you give blood as someone from an African background, it's more likely to go to someone from a Black background. It may go to other people, but equally people from other ethnic backgrounds may give to sickle cell disease. I think you have to look at the overall picture, that, you know, we try and treat everyone, and we try and get the best blood for everyone. So we will use the blood in the best possible way, and similarly we will take blood from any background to make sure that the sickle patients get the best treatment. So we will match it as in the most effective way, but if you look at the overall picture, it is more likely to go to Black people, but not absolutely certain. And in terms of if you're if you're from a Black or African background and giving plasma, it's more likely to go to a Black person, because unfortunately, as you know, that people from Black and ethnic minorities are more likely to become ill with COVID-19. So in proportion to the amount of plasma given from Black and ethnic minorities, more of it, you're again more likely to go to a Black and ethnic, someone who's sick with COVID from a Black and ethnic minority background than someone from another background. Does that make sense?
Yes, that makes sense. I think I guess similar to the issue with solid organ transplantation, in that you don't necessarily match the risk, but you've got a higher chance. Because of.
Yes, I think the solid organ and stem cells. I mean, because we need such a close match, and there are thousands of different groups, types. It's almost certain to go to someone from the same ethnic background, or someone perhaps from a mixed background, but it's almost certain to go to someone from the same ethnic background. So that's slightly different. I think for blood, and blood is very, is likely to be used for someone with sickle disease, but not certainly. And of course, if you gave lots of times, you would give blood sometimes for sickle disease, but I mean, you may give it to someone who's, Black person who's got cancer, or someone else. I think for plasma, it's just, we know that about the risk of being severely ill with COVID is much higher if you're from a black and ethnic minority background. So again, it's more likely. And some people have given plasma lots of times. I mean, people can give, if you've got a very high level of antibodies, you can give weekly. One person's given about 24 times. So if you think we were to use all of that, sometimes, more often it would go often to someone from a black and ethnic minority background and some from another background. So I think you have to look at it in the whole. If we encourage everyone from whole groups from black and ethnic minority backgrounds to give blood products, to register on these different registries, it will help the community enormously. And I think it's also raises awareness and raises support for the different diseases in different ethnic groups. So I think there are many benefits from getting together, from registering an interest and encouraging people to support people who are sick with sickle disease. And I know that kidney disease is more common in people from an black and ethnic minority background. So I think it's important for the whole community. It's, obviously we're talking about plasma today, but if people can look at the big picture of how to help people, it would be terrific. Does that help, Theophilus? You've been very kind in directing these questions.
No, that's very helpful, and thank you very much for addressing them comprehensively. The next question is perhaps a little bit more tricky, and I say so because it refers to a specific episode. And it says, plasma is used to treat lupus, but the hospital I go to for my red cell exchange did not agree to do it for me, despite going for the trial. I'm not sure how. Why was I refused?
So I don't know this trial. So I presume it's someone with sickle disease who is having red cell exchanges but has lupus as well, but it's difficult to know.
Yeah.
I don't know the answer. I there's a general point here. If you go to hospital and you don't understand, the best thing is to ask for more information, to ask to speak to the doctor or the nurse. And I know my colleagues, and I hope everyone in the health service would want to take the time to explain something. I can make a guess at this, that I think if there was a trial giving plasma, you might be allocated to either have plasma or not have plasma. And the trouble is, if you've got a red cell exchange as well, you would already get quite a lot of plasma from different people. So I think it might be very difficult to understand the trial if you having a red cell exchange and then went into a plasma trial, because you would already be getting plasma. Does that make sense? And Theophilus,
there's a follow-up explanatory. Says someone with sickle cell disease went for the trial, attended conferences about plasma donation, but when they asked about treatment with plasma, they were refused. Once again, I think it's always I find it very difficult to deal with these very individual medical scenarios.
Yeah. And Bruce I think the individual questions are a bit difficult, but please, if you are unsure or you unsure about the treatment or what's happening, please try and ask the people who are treating you. And if you ask, I really would like some more information, could I have a different appointment just to come and discuss this? I think the principle in the health service, I know the principle in the health service is that, people should have a very good explanation. And as far as possible, unless people are incredibly busy or there's an emergency, people should make time to explain things to people, because I do believe that, treatment is very much a dialogue between the patient and the doctor. And I right from when I first started treating hematology people, and I can't tell you how long ago with this, but it was before the year 2000. One of the first things I did was write an information booklet for people. And I think the more people know about the disease they've got and the treatments, they feel much better. They can have you can have a much better discussion with the doctor, and of course, from the doctor's point of view, it's much better having people who know about things and and are able to discuss things. So it's easier all round. So please, if you've had difficulties, if you can go back and ask for some more help, and maybe one of the nurses or one of the medical staff or the consultant even can sit down and go through it with you. But I think it is important to try and obviously to inform, to get as much information you can and take, discuss it with all your treatments with the doctors and nurses, because they should really want to do it, because it makes everything much easier. It's easier for you, it's easier for the doctors, and in the end, the more you understand, the happier you are with the treatment, the better things will go. And I'm sure, Theophilus, you can say the same for surgery. The more the more people know, the easier it is, isn't it?
That is true. That is true. And communication is key. We have established that there is an ongoing reluctance or hesitancy in asking for information from Black and minority ethnic community groups, especially in official settings like hospitals.
Yes.
And oftentimes they go through what is, to my view, a very comprehensive and a very informative consultation when I look at the letters that have been copied to the patient, but most of that hasn't been taken on board, even though they've had access to the material, to the letter to the GP. And so I think that level of interaction with the health service is something we're still working to improve, the comfort levels. And I think that's where some of the health inequalities come in. But I mean, certainly communication and breaking things down to a level where people understand them easily and people trust them and have the confidence to at times challenge with beliefs they bring into the consulting room is always very useful.
Well, I mean, it's a more general point, but it's an important one. And I think we're all very aware of the barriers that exist, and it may well be that I'm sure it's the case. We need more people explaining things, more people are doing the explanation from different backgrounds, and also, I mean, we've mentioned it before. I'm very much aware that when we say people from, we could just take people from Africa. There's Africa's not just hundreds of countries. Each country has many, many different groups, and equally, someone from the Caribbean may feel happier speaking with someone from a Caribbean background, and the different parts of Africa and Asia. It's not just black and ethnic minorities as one group. We need many people doing explanations. The other thing that I think is important is that if you're having difficulty speaking to the doctors and nurses, it is helpful to bring a friend along, I think, or a relative, so you can both hear it. Because I think if it's you and your disease, often it is difficult to concentrate and hear everything, because when people are giving an explanation about your disease, you're thinking of so many things, and it's often helpful to have someone else there and to bring questions written down and to write things as you go along. I mean, communication isn't just one discussion; it's a whole, process really. So the better you can make it, the more help you can get, I think the better it is. I'm sure that you find the same in surgery, that if you tell people about an operation, it's a huge help to have somebody there to help, process the information, remind people about it afterwards.
It is. I mean, I was talking to a colleague about this actually just earlier this week, in that for a long time, I was under the misconception that information I gave out was actually taken in until I took my car for a service and had some work done. And 2 weeks later, I couldn't remember what had been done. And that brought it home to me that I was in a foreign environment. My car had a lot of work on it that's done. And I knew at the time, but 2 weeks later, I couldn't remember. And yes, people often attend the consultation in a heightened state of anxiety, and a lot of what you say may not get into them.
Yeah, it applies to everyone from every ethnic background, but it's perhaps more of a it's more help to have someone come along. But again, people are trying to make things better, but the more people that are aware of it, you've got a fantastic group here. And, I'm sure these messages and the ideas we're talking about, it's not just about plasma. I think we've touched on much more than that. I can see Bruce has put something in the chat about how you can register on the website. We are doing some tests where people can volunteer to have a test first to check their level of antibodies. So if you could check that out, that would be good. We're trying to do this in many thousands of people a week by post. So people get posted out a test kit, and they do they can just scratch themselves with a needle and drop some blood into a tube. Not everyone will do it, but lots and lots of people have done it. We've got thousands of tests back a week. So we started doing that testing at a distance, and you post the tests back. In fact, that's a new innovation for us, and it's one of the ways in which, like many emergency situations, it makes people think of new ways of doing things. So it's one of the sort of side effects of the whole COVID crisis that, people are thinking of new things, and that's one of them.
Yeah. So
yes, and someone said that they get copied into letters. So what you should ask to be copied in the letter if you're a hospital patient. I mean, in fact, we've now started addressing our letters to the patient and copying it to the GP. Again, I'm talking about haematology here, not donation. But someone's asked what time the session ends. I'm happy to answer a few more questions, but usually these things are for an hour. But I know it was scheduled for a bit longer.
We are getting up to about the hour mark, Prof, and I thank you very much for your patience and your very thorough explanation of the key topics that have gone through. And unless there are further questions in the chat, I'll just at this stage say that there's a need for people to put themselves forward to donate convalescent plasma. The treatment is still being evaluated to see which patient groups will benefit best from it. And it seems that because Black, especially men, get a more severe disease, they do produce much more antibodies. And so those that particular demographic are much more likely to be suitable for donation. I think if you've been unfortunate enough to get into hospital with COVID and then fortunate enough to come out, because for 100,000 people haven't been that fortunate, then doing something to try and stop other people from succumbing to this awful disease can only be a good thing. In terms of the use of the convalescent plasma, you're more likely to have your plasma given to somebody from the same ethnic background, partly because of the genetic variation that occurs in your particular ethnic subgroup, but also because Blacks seem to be disproportionately affected and actually more likely to become sick and more likely to need convalescent plasma. One thing that we can all do is to raise awareness about the need for convalescent plasma donation if you've had COVID. Even if you haven't had COVID, there's the opportunity to donate plasma when the program restarts and when there's a call for them, and also to donate blood. I'll just digress a little bit and say, the NHS blood supply depends entirely on people deciding to go and donate blood. There are no payments made, there's no mandate, but it's been working like a smoothly oiled machine for years. And I know that in many countries in the world, this isn't the case. And supply of blood and blood products is in short, is unreliable. But the NHS blood transfusion service means that we have this broken chain. It has been a pleasure to have Professor Roberts with us, who is a world-renowned authority actually in the field of hematology. He's a professor of hematology at the University of Oxford and has been so for the last 19 years. He's been a consultant hematologist for 23 years, but continues to do clinical work at the John Radcliffe Hospital in Oxford, largely with immunohematology, immune thrombocytopenia. And he's done a significant amount of work on malaria, which you might have guessed when he said he's done a lot of work with countries in Africa. He's helped set up postgraduate training programs as far-flung places as Tanzania. He's the editor-in-chief of the journal Transfusion Medicine, which is the official journal of the British Blood Transfusion Society, and he chairs the research committee of the Royal College of Pathologists. He also sits on the board of the British Society of Hematology. I could go on and on, but time doesn't permit. And he's currently attending today to speak in his position as the Associate Medical Director for Blood Donation and the Medical Lead for the Convalescent Plasma Program at NHS Blood and Transplant. The material which has been gathered today will be put out on the website, usually within about 48 hours, so that it can be continually accessed. And I think it has been a tremendous session, and my thanks do go out to you for breaking things down so well, Prof.
Well, that's great, and a very, very thorough resume. I wasn't expecting that, but again, just to reiterate that the convalescent plasma is very useful at the moment, but also we do need more red cell donors and people to register for stem cells, and beyond that to take the message to communities that this is something that will help lots of patients, and it's something that people can get involved with, and some people will donate their whole lives, and many of you also will go back to other countries, and I'm interested in the transfusion services across Africa. And if you get interested in transfusion, it might be something that you can really, really help with in other countries, because we're very lucky. We have a very safe and secure supply of blood where we can go to a fridge in a hospital and get blood. And in many other countries are building up transfusion services. So again, it's something that can have a wide impact. However you get involved after this session, it might be something you can take up in a much wider sphere. So, and we've also touched on communication in hospital. That's incredibly important to help people. So I do hope the message will go out to really get involved in all sorts of community ways in helping the health service and helping your communities. Thank you very much. It's been a real pleasure to talk. And Theophilus,
thank you very much
for your wonderful chairing and guiding us through the questions. Thank you. It was really good.
I'm going to hand us back to Hilary at this stage for some closing comments. Hilary.
Thank you very much, Theo. I'm going to play a video before we end, and I would like you to listen and make a decision on what you want to do next.
We urgently need plasma donors now. Coronavirus has been affecting Asian people more than the general population.
I didn't realize that I had COVID-19 until I tried to help my parents with their shopping, and just something as simple as bringing the shopping back into the home made me breathless. Donating convalescent plasma is very safe. They look after you very, very well before, during and after the entire process. It's definitely something that I will want to come back to do again.
We found that Asian plasma donors have higher antibody levels, which are particularly useful to help save lives of those affected by coronavirus.
So I would encourage them to donate wherever possible. Definitely try and help out.
By donating convalescent plasma, you could save lives.
So we are at the end of this session, and I wish it didn't have to come to an end. Unfortunately, it has. I want to thank again Professor Roberts for helping us understand how plasma donation, the plasma donation process works. We also extend our gratitude to Amanda for opening the session and talking about her work, and also to Bruce, who has been in the chats all day, talking about answering people's questions in the chats. So I would also like to thank profusely Theo, who has volunteered his time to engage with Professor Roberts, asking questions on our behalf and helping us to understand about plasma donation. And I hope that, everybody who's come in today, you're not going to go away, have an idea of what it involves, what it means to be a plasma donor. And I will ask you, as you go into the community, take the message with you. Speak to your neighbors, your brothers, your family. It's just like blood donation. Over a cup of tea, speak to your family. Talk to them about plasma donation, because we do need every single one of you donating and also asking questions. If you call the number that's in the chat, that Bruce has put in the chat, you can speak to somebody who would explain the process even further, and you make that informed decision to help somebody like you and I. We need that. We've talked a lot of times, we've spoken out about how COVID has affected the community, but we can't just talk alone. We have to put our words into action and go forward and agree to be a plasma donor if you've had COVID. Thank you very much for coming out today. And I hope that in the next 2 weeks, when we come back with either organ donation or blood donation, you'll be here supporting us and helping us spread the message about organ and blood donation. And again, and just now, we've added plasma donation to our campaign as well. So thank you again, everybody, for coming out, and have a wonderful weekend. Thank you, Prof, for coming out, Amanda and Bruce, for your help today. Thank you. Bye.
Bye now.
Bye-bye.